Broadcast is now starting. All attendees are in listen-only mode.
Welcome everyone to our Cecilia Health webinar this evening. We're going to be talking about diabetes complications. So say no to diabetes complications and say yes to reducing your risk, keeping your kidneys, nerves, and eyes healthy. Should you have any technical difficulties during the broadcast, there is a phone number to call at the bottom of the screen. It says to call Citrix Support 1-800-263-6317. This is an interactive program this evening, so our format will include a short presentation followed by an interactive discussion. To type in a question, use the questions section of the webinar toolbar. At the end, you'll have a chance to ask questions, so we look forward to an interactive webinar this evening. Just a disclaimer, we know that the information you're about to hear may motivate you to make lifestyle changes, so please consult your physician before making any changes to your current routine. The Cecilia Health Certified Diabetes Care and Education Specialist will provide strategies to help you manage your diabetes. This online Q&A session is intended to give general advice. This information is not a substitute for personal medical advice and involves the professional opinion of the Cecilia Health Certified Diabetes Care and Education Specialist. So our speaker this evening is Emily Gibbons. Emily is a registered dietitian and a certified diabetes care and education specialist practicing in Ohio for the past 15 years. She earned her bachelor's degree at the University of Dayton and completed her postgraduate internship at Johns Hopkins. Emily spent the first 8 years of her career working in dialysis prior to becoming an outcomes coordinator and certified diabetes care and education specialist for a local hospital system. Emily's currently a senior team lead and certified diabetes care and education specialist for Cecilia Health. Recently, she was awarded the Certified Diabetes Educator of the Quarter award at Cecilia Health. In addition to this rewarding work, Emily's also actively involved at the local level as the program coordinator for the American Association of Diabetes Care and Education Specialists. Emily's passionate about diabetes and has committed her career goals to empowering and educating patients with diabetes. So thank you very much, Emily, for being with us this evening, and you may take it away.
All righty, thank you, Katie. I hope everyone's doing okay tonight. I'm in Ohio and I just looked outside and it's snowing out there, so. All right, so we're gonna go ahead and get started. So tonight, our discussion is gonna focus on microvascular complications. So what do we mean by microvascular complications? How can these problems be prevented? And as Katie mentioned, there's going to be time for you to type in a question if you'd like, and I can certainly try to answer that as well. And then just a reminder, just please talk with your healthcare provider before making any changes to your diabetes treatment plan. Okay, so let's start off with just what are microvascular complications. So high blood sugars can cause both microvascular complications and macrovascular complications. And I know those terms are long and kind of sound complex, but macro just is referring to the larger blood vessels. So that would be some complications such as coronary artery disease, stroke, peripheral arterial disease, things like that, and cardiovascular disease. We're going to focus today on the micro, so that's the smaller blood vessels. The micro stands for that. So this is just damage to those small blood vessels. And it can be caused by too much sugar in the bloodstream from uncontrolled diabetes or too much blood pressure inside the blood vessels. This would be also known as high blood pressure. Okay, so as far as what parts of the body are affected, and you can see this diagram of the human body, and you can see really from head to toe, it's affected in different parts of your body, starting at the top. So organs with very small and delicate blood vessels can be easily damaged. So your eyes at the top there, and then you can see in the middle, it's referring to the kidneys. And then towards the bottom there, we have the nerves and the feet. So good blood sugar control can delay the onset of any of these issues, as you're going to see throughout this presentation. So we're going to first start with diabetic eye disease. Okay, so high blood sugars from diabetes can damage those tiny blood vessels in the retina, and it can cause these problems. And as it's listed here, you'll see blurry vision, cloudy vision, an increase in eye pressure, and then worst case of loss of vision. So those high sugars can cause these problems. And diabetic retinopathy, which is what it's called, can cause these blood vessels in the retina to actually leak fluid or hemorrhage, and then that can distort your vision. And just so you're aware, the retina is that light sensitive layer of tissue that lives in the back of the eye. In advanced stages, so these are in further along stages, new abnormal blood vessels can increase in number on the surface of the retina, and that can lead to scarring and cell loss in the retina. So obviously a super serious thing. It's the leading cause of blindness and visual disability. So we just want to be paying attention to those if we see any of those things listed here. Okay. And then obviously we want to know, how do we prevent these things? So early detection treatment can reduce the risk of blindness by 95%. So that's pretty impressive. And how do we do this? Well, get a dilated eye exam at least once a year, which many of you are probably familiar with, because diabetic retinopathy often goes unnoticed until there's maybe a problem like vision loss. People should just go ahead and get that dilated eye exam every year, no matter what, regardless of if you're having any, vision issues. And this will allow that doctor to check for a number of things like changes to your blood vessels, leaking blood vessels, or warning signs of leaking blood vessels, things like issues with your macula, changes to the lens, damage to any nerve tissue. So going to the doctor, they can look at all these things and examine it, because you're not going to feel it necessarily. And keep in mind that, just because you do not have any changes doesn't mean that you do not have changes to these blood vessels. And vision may not even be affected until later in the progression of, the actual eye disease. So can't highlight that enough there. Okay. And then as you're going to kind of see throughout this presentation, these two strategies are going to be really familiar with you, because these are the most important ways to prevent all the complications we're going to discuss. And that would be keeping your blood sugars under control and making sure to keep your blood pressure under control. So those two things you're going to see throughout this presentation. What can you do to keep that in goal? And so the next one we're going to go into is the diabetic nerve disease. Okay, so high blood sugars can also damage the nerves, and that can cause some pain, burning, tingling, kind of that pins and needles feeling, and a loss of sensation. And in more serious cases, it can lead to problems with digestive systems, urinary tract, blood vessels, and the heart. And they can be very different in your feeling. So it can be maybe just an occasional feeling of this burning, tingling, loss of sensation or pain. And it can be even quite painful and disabling in some severe cases. And the most affected areas are going to be your hands, your legs, and the feet. And diabetic nerve disease is one of the more most common complications in diabetes. and like I said, a wide range of how this might make you feel. And you may have had a monofilament test, and we're going to kind of go into that here in a short bit. Okay, so these are just some other problems for the feet and the legs. So damage to these small blood vessels can reduce some of the blood flow, and this is what can happen when that blood flow is reduced. It can lead to sores that won't heal, dry and cracked skin, can be swollen or bluish feet. And then it can be things like legs that are hurt during exercise, or legs that hurt or feel restless at night. So those are some other additional problems can happen as well. And the next slide here is just showing how, damaged nerves and poor circulation, those two things combined can be pretty dangerous. So nerve damage can cause a person to lose feeling in the feet. And then, so as a result, you're not going to feel pain, pressure, you might not feel heat or cold. And you may not notice that your shoes are causing a sore, or that you have injured your foot in the first place. So you put your shoe on, you go about your day, get home, remove the shoe, and there's a sore on there. So decreased sensation to the feet can lead to people not recognizing cuts, and that can result in a lot of other problems like foot infection. So the sore can, become infected. And then that poor blood flow makes it hard for the body to send special cells to actually fight the infection. So on top of it, the ability to actually fight it is compromised as well. And infections can, in worst case scenarios, can lead to more serious things such as amputations of the foot and toes, legs, etc. And sometimes even people you will see with nerve damage can also have problems with balance or coordination. And as a result, sometimes individuals will have some falls or fractures because of this as well. Okay, so the important thing is kind of getting into, well, what can I do to prevent this? Because, we don't want to have this happen. So what can we do? Well, one of the most important things you can do is practice good foot care. So foot care is important for all people with diabetes. And certainly if you have any kind of peripheral neuropathy or nerve issues, you certainly want to make sure you're checking your feet every day. So every day, and then every time you visit your health clinic. So that could be not just necessarily a podiatrist, but that could be your regular primary care doctor or nurse practitioner. Make sure you take your shoes off and have your feet looked at. So that could be when your doctor is, you're getting checked into your appointment. You may just want to take your socks and shoes off and just kind of have them already right there. So when the doctor comes in, you can just have them check. And then also once a year, you should have a full foot exam in which the doctor is going to use a tool to actually look at the sensation and the circulation. And that's that monofilament testing that they can do. So again, checking your feet for problems every day, looking at them when you get home, taking your socks off, examining them on a regular basis every single day, and then following up with your doctor and having them look at your feet as well. And then the next several slides are just going to be some foot care, because we felt like it's such an important thing for people with diabetes. Wanted to spend some time just showing you some basics of what you could do to make sure that your feet are taken care of in the best way possible. So there'll be some of those slides. So as you can see, this is like a mirror of the foot, because obviously sometimes we can't see all the different the back and the front of the foot always. So this is allowing the patient to examine their foot even in more depth there. So if you want to use something like that, that's not a bad idea. But every day, like I said previously, just want to make sure you're checking your feet for cracks, blisters, cuts, dry skin, making sure that you're not just looking at the front of your foot, but at the bottom, in between your toes, making sure that you are using a mirror or someone help you if you cannot see those bottoms of your feet. And if you see something unusual, especially a sore of any kind of sort, or if you're not sure what you think something is, it's best to just call your doctor just to be safe. Okay, and then you want to just make sure that you're washing your feet daily with just mild soap and warm water, so nothing, really, really hot. And you want to make sure you test the water first. Just like, when you test it with a baby with the bottle, you just want to make sure that you're testing it with your wrist or your elbow, just to make sure it's not too hot, rather than using your feet as the first source of that, because sometimes if you don't feel that source of hot and cold, you may not notice that, and then you're just going to submerge your foot into something that's really, really hot. And you want to make sure you're drying your feet well. So just taking a towel and just getting those dried up really nice, including between your toes. And then this is a big one that I think sometimes is hard to grasp and to kind of adhere to this, but do not soak your feet, because this can cause your feet to be dry. So keeping that in mind as well. All right. And then when it comes to lotion, just use lotion on the tops and the bottom of your feet, and any of those extra areas with the dry skin. And do not use any lotions that have perfume or alcohol. So it's best to avoid those kinds of lotion for your feet. And it's important to not perform bathroom surgery, as we call it, but trimming your toenails straight across with a nail file, not using nail clippers. And then, if there's anything, again, anything unusual, corns, calluses, warts, I know it's tempting at times to try to take care of those yourself and not have to go follow up with the doctor, especially with, everything else that's going on oftentimes with these appointments. But do not try to treat everything by yourself, because you can put yourself at risk for infection. So it's best to actually see your doctor for that kind of stuff. Okay. And then this is a big thing to keep in mind. Wearing comfortable shoes that fully cover and protect your feet all year round. So a huge issue is when people don't have shoes that fit them properly. So those can lead to all sorts of foot problems, sores, and all sorts of problems. So just making sure, and in this visual here, we have, I know summer's coming up, but we have the flip-flop, which is certainly not very, safe and fully protecting your feet, but just making sure to find shoes that are going to be appropriate for you. And then shaking out your shoes and socks before you put them on. So if there's any little small objects in there, rocks or any just, things that dirt that can kind of build up, anything that could be in the shoe, you certainly don't want to put that in. Put your foot in, and then it could lead to having issues once you start walking around with those shoes, and it can lead to problems. And then another one I think is important to always highlight is never going barefoot, I should say, even when you're indoor, you're inside of your own home. So, I mean, I know, it's certainly you're walking around your own home, but there's all sorts of things that you can accidentally step on and can lead to problems. So if possible, wearing something on your feet at all times while you're in your house is critical. Okay, so again, how are we going to prevent these foot problems? And it's back to those two things I said at the beginning when we came to the eye disease, is keeping your blood sugars under control. And then another thing here is quitting smoking. So it can lead to issues with circulation if you smoke. So in general, being active, sort of thinking of everything that, like, in the perfect world, what we would want you to do. So, your diabetes meal plan, quitting smoking, taking the medications as prescribed, those kinds of things to help the blood sugar stay under control. And then, of course, getting some help to quit smoking. Okay, so we've went through eye disease, foot, nerve, and now we're going to just kind of move into a little bit about kidney disease as well. Okay, so kidneys. So kidneys are actually the size of about an Idaho potato. Um, and kidneys are really important. They clean the blood and they filter out the waste, and that can make us sick if it stays in the body too long. And so the main job is just to filter those waste and that water um, to get it out of the blood to make urine. It controls your blood pressure and makes hormones that your body needs to actually stay healthy. So high blood sugars and high blood pressure can cause damage to those small blood vessels in the kidneys. So that's why we're talking about it here. And people with kidney disease, I think this is huge, but people with kidney disease may not have any symptoms at first because it can occur slowly and over many, many years. So you won't necessarily feel those effects. And then as it progresses, what happens is waste that's not able to be removed can make you feel sick, because when the kidneys aren't filtering blood like they should, those wastes build up in the body, and that's going to make you feel really sick over time. And those high blood sugars can actually damage those blood vessels in your kidneys as well. And so I put a little bullet down here about dialysis because you know, if there are issues with kidneys and it gets to the point that they're not able to filter things at all properly, dialysis is an option, and you may have heard of it before, but it's when we use a machine to filter out those wastes from the blood if those kidneys are, you know, no longer able to do it. And as of right now, I've had a lot of experience in dialysis, but now there are so many different options of dialysis. Home dialysis, in-center dialysis, peritoneal dialysis, and of course transplants as well for kidneys if it got to the point where dialysis was a long-term thing. Okay. Okay, and this just is like, I know it's a busy looking slide here, but this is just, again, kind of an explanation of when you think of the kidneys. They're like a colander, like you're using to drain water from pasta. So it's filtering out the waste, which is the water, but it's keeping what the body needs, which would be, in this example, the pasta inside the bloodstream. And so when the kidneys start getting damaged over time, it's as if that colander is getting leaky. But instead of pasta, what the kidneys are doing is is letting protein through. And protein's a large molecule. Our body does need it, and normally it doesn't spill into the urine. It's not something that should happen. So when it does start showing up in the urine, that tells us that that colander is getting leaky and that there's some type of kidney damage occurring. Okay, so what can we do to prevent ourselves from even getting to the point of this? Well, there's a couple things. And I know you're going to realize that other one with the other two I've been saying throughout, but these are some key things related to kidneys. So having a urine protein test every year, and that's called a microalbumin test. That's very important to get this checked out every year. And, you know, asking your doctor how your kidneys are. Oftentimes, you know, you may go to the doctor and you may not hear whether or not anything's going on with your kidneys. And chances are everything's okay. And that's why you haven't heard anything. But always asking, how's your kidney function, or how are my kidneys? And just starting to like look at those numbers would be kind of a good step in the right direction, just keeping track of that. Also, drinking 6 to 8 glasses of water a day. If you are still smoking, getting help to quit. And then, of course, these are all, we would do this anyways, hopefully, but taking all your medications as directed, including, you know, your blood sugar medications, blood pressure medicines, and then staying active as much as possible, eating healthy. And then, of course, most importantly, keeping those blood sugars under control, and then keeping your blood pressure under control as well. So that's how you're going to prevent those kidney issues as well. And of course, just a reminder, most people aren't necessarily getting these complications, but it's important just to be aware of them. Definitely not designed to scare anybody, but just to be aware of them so that you can do your best to keep your blood sugars in control and the blood pressure control, so that, you never have to worry about any of these things. Okay, so as far as questions. So if you do have any questions, you can use that question tab on your toolbar. If you have a question and you would like, an answer to that, or if you'd like to just share something. I mean, sometimes you may not have questions, but you might just have a tip that worked well for you that you want to share with everybody else that's here tonight on the webinar. And what I can do is click on that and, try to make sure to look at it and answer it for you. And then just so you're aware, these are a couple live events coming up. You can let your diabetes coach know and they can send you a schedule about these, but I know it's already April 22nd, so April 28th, which is already next Tuesday, I believe, at 6 p.m. There's a COVID-19 prevention and preparedness tips. So I think that one looks really interesting and is very, very relevant given what's going on. So if you can at all attend that, I'd highly recommend that. But again, that's already next week. And then after that, we do them pretty much every month. So the following one is May 11th, and that's the safe and smart exercises for people with diabetes. So as the summer is kind of nearing, there's some good ideas in there. If you want to sign up for all of them or both of them, or I mean, any of them, definitely welcome that. All right. Okay, and I did get, I'm going to just kind of pull up some of the questions here. Yes, so okay, so I think the first one I have is can you spell that kidney test? Yes, so you can, it's MICRO, albumin is ALBUMIN. So that's microalbumin test. And sometimes if you just ask, how are my kidneys doing, the doctor, should be able to provide that level. And if you're getting lab work drawn on a regular basis, it should be fine. Okay, perfect. And I think there is another question. So the other question we have is just, what are some of the risk factors for diabetes or for kidney disease? I'm sorry. So as we said before, you want to keep your blood sugars in control. You want to keep your blood pressure in control, but also kidney stones can be a risk factor. Obesity, smoking, as we said before, as well, and then cardiovascular disease is also, there's a connection for a risk factor for kidney disease. And then being like a history of kidney disease. So if you have any in your family that's had a history of kidney disease, you want to make sure that, that could be a possible trigger for you as well. And then also being over the age of 60. So like many things, as you age, that can also impact or cause a risk factor for kidney disease as well. Okay. Alrighty. And then as far as normal blood sugar ranges, I did want to mention these. It's not necessarily a question, but more of a comment. Everybody's blood sugars are going to be, the ranges are going to be specific to them. So, you may have a different goal than somebody else has. But the 80 to 130 level is what we want fasting or before meals, and that's from the American Diabetes Association. 2 hours after you eat your meal. So that would be less than 180. And again, that is just a recommendation. And again, like depending on what your goals might be, your doctor might have yours be different than that. But that's just like a general goal. Okay, and then does drinking diabetes, or does drinking diabetes, wow, does drinking coffee hurt diabetes? So no, so certainly a couple things here. What we drink is really important, right? You know, because our things that we put into our mouth as liquids and that have high sugar amounts, they can certainly cause our blood sugars to go up. But coffee is there's no, you know, no issues if you want to have a little bit of coffee. Just focus on what's in the coffee. So you know, if you're putting sugar in the coffee, that's obviously a concern. If you put a ton of cream in there and it's got a lot of fat in there, those can all, you know, cause you know, some issues. So you know, if you want to have a little bit of coffee, you know, black coffee is fine. If you want to put a little bit of cream and then maybe even some kind of stevia or sugar substitute in there, that's not going to raise your blood sugars. Certainly, that's okay as well. Yeah, and then I think I got, okay. The question about the clippers, so somebody asked about using clippers designed to cut straight across. I would probably, you know, if those are okay, I would probably just follow up with your doctor on those to make sure that that those are okay to use, because without seeing them, I don't want to tell you one way or another. But you know, you just want to, maybe the next time you have your doctor's appointment, you can bring them in and just say, hey, this is what I'm going to be using to clip these. Are these going to be okay? And then see what, you know, he or she says about those, just to be on the safe side. Okay. And I have another question about walking. So how much walking should a person do on a daily basis? So this would be distance/minutes. So, well, as far as exercise, always you know, run that by your doctor to make sure that, you know, your physical activity is in line with what, you know, you and your physician or nurse practitioner have kind of come up together with, because we want to make sure you're as safe as possible. Of course, walking typically, you know, a lot of people are able to do that without any issues. And it just depends on how kind of your goals, but the general recommendation is 150 minutes a week of exercise, and that can definitely change depending on if you're looking for weight loss or other kind of benefits beyond just keeping yourself physically fit. We do know a positive thing about exercise is that even small walks after meals or any kind of physical activity where you're moving, and especially walking, can definitely help with those blood sugars going down. So that's the benefit of exercise. But again, just double checking with your doctor to make sure you know, you're safe when you're doing that as well. But hopefully we'll be able to get out there in the everybody, depending on, you know, what the temperatures are going to be like, can get out there and move a little bit more as we enter into the warmer months, or at least where I am. So I'm not sure. Okay, and then I did get a question about an electric blanket. You know, my doctor told me it's more of a comment that I shouldn't use my electric blanket in the winter anymore. Do I agree with that? Well, certainly if your doctor said that, I would definitely go ahead and follow that. But you know, using any kind of those heating pads or hot water bottles or hot bottles. I know, like when I get sick and I don't feel good, I fill up those bottles with hot water. You just want to make sure that that you you're careful, because they may be too hot and they can cause damage to your skin. So I would recommend not using those for your for anything. Is I agree with what the doctor has said there. So okay. All right. And then are there any exercises good for foot circulation? You know, again, I know I've said it before, just double checking with, physician, making sure that they know that what you're doing as far as exercises, so that you're all on board. But with that being said, walking is always a good exercise, as long as you're able to do it. If you're not able to walk and that's an issue, stretching, various stretches that are kind of milder, that you can do to kind of stretch out your body. Depending on your situation, there's all sorts of chair exercises that are available online. If you would actually use the computer and Google, there are plenty of good low impact type of exercises that might be good for your foot circulation, like heel lifts and different leg stands and stuff like that that you can do. So I'd also check back with your diabetes coach, because they may have some good resources to send you. I don't know if you communicate via email or text, but they have some really good resources and email that they can send for exercise. So that might be another thing to think about too. Okay. Okay, and I think I have another question about exercise, and it looks like, do we need to do upper exercises for our arms, and is that a benefit? I think that's what it is. So yeah, I mean, again, I know I hate to keep saying the exercise follow up with your doctor thing, but certainly doing that, like I've said, and then resistance training is really important too, and that can be, doing some light lifting, if it's appropriate given your situation, some resistance, meaning, lifting some things. So sometimes it can be, doesn't have to be going to the gym and doing some powerlifting or anything. It can just be simple things that you can do in your home. Even if you don't have actual like weights to lift, even just water bottles full of stuff just to lift up. But certainly resistance training is good, along with some of that walking. But again, following up with your doctor is the best bet, and seeing what kind of plan that you're going to come up with, and if your diabetes coach as well, what they suggest, given that they might know you and your specific needs a little bit better. Okay. All right. I don't see any more questions. I think this group was the most questions I've ever gotten in one of these, so I'm really, really excited that it was interactive, and that you were able to, I saw some comments on here, that, thank you, great information, I'm learning a lot. So I do really appreciate those comments too, and I will send those over to our team as well. And thank you for joining us today. Really appreciate your attendance and participation, and hope to see you on some more of these coming up here shortly. All right, thank you, and have a great day, everybody. Bye-bye.